Looking to escape the billing nightmare that's consuming your home health agency? While you started with one clear mission, delivering excellent patient care, billing has somehow become the monster eating your resources, stretching your staff thin, and keeping revenue that should be in your bank account stuck in accounts receivable limbo. In the next 6 minutes, I'm going to walk you through exactly why most home health agencies eventually turn to home health billing outsourcing, and more importantly, how to distinguish between billing companies that will actually solve your problems versus those that will make them worse. Here's what most agency owners don't realize. The journey to outsourcing follows a frustratingly predictable pattern that costs agencies years of lost revenue. But understanding this pattern and the specific complexities of home health billing that make it so different from other medical billing can save you from making expensive mistakes. Let me guess how your billing story started. In the early days, you handled billing yourself. This actually worked when your census was low and claims were straightforward. But as your agency grew, billing demands started competing directly with patient care and business development. Claims started aging, cash flow became unpredictable, and you knew something had to change. So what's the next move most agencies make? They hire a dedicated biller, sometimes full-time, sometimes asking clinical staff to split duties between patient care and billing. Here's the math that seems to make sense. For agencies billing between $1.5 million and $3 million annually, even a 2 to 4% home health billing outsourcing fee represents roughly $30,000 to $120,000. That seems expensive compared to a single employee's salary, right? But here's what those calculations completely miss. A dedicated biller costs far more than salary alone. Benefits, training, management oversight, software, and coverage during absences add up quickly. More critically, a single biller lacks the accumulated knowledge and data insights that come from managing billing across dozens of agencies. Before agencies find the right home health billing outsourcing solution, they typically exhaust several inadequate alternatives that sound logical but fail in practice. The first trap, asking clinical staff to split time between patient care and billing. The logic seems sound, reduce overhead by combining roles, but here's the reality. Nurses don't want to do billing, and billers can't provide clinical care. Both functions suffer when combined. Claims sit incomplete while clinical demands take priority, and revenue that should flow in 30 to 45 days extends to 60 days or more, or never arrives at all. The second common mistake involves hiring billing consultants who promise to fix your processes. The consultant identifies problems, recommends solutions, and moves on. But here's the thing about home health billing. It's not a one-time fix. Government regulations and payer policies change constantly. Under PDGM, Medicare categorizes 30-day periods into 432 possible case mix groups, each with different payment rates and LUPA thresholds. What worked last quarter may not work next quarter. Eventually, most agencies do try home health billing outsourcing, but they choose based primarily on cost. They find billing companies offering rock-bottom rates without investigating what those rates actually deliver. The results are predictable. Low-cost billing companies either lack home health specialization or can't afford adequate staffing. When billing companies face high costs to work denials with limited resources, your claims often get written off instead of collected. Money you earned, but never receive. Now, here's why home health billing is uniquely complex compared to other medical specialties. The patient-driven groupings model fundamentally transformed home health billing when it launched in 2020. Unlike previous payment systems, PDGM requires precise attention to multiple variables that directly determine reimbursement. Every 30-day period must be classified by admission source, timing, clinical grouping, functional impairment level, and comorbidity adjustments. Each variable affects payment. Miss a comorbidity that qualifies for adjustment, and you leave 20% or more in additional payment on the table. Fall below the LUPA threshold by even one visit, and you receive per visit reimbursement instead of the full case mix adjusted rate. losing 60 to 75% of expected payment. But the complexity doesn't stop there. With more than half of Medicare beneficiaries now enrolled in Medicare Advantage plans, agencies that can only handle original Medicare billing are limiting themselves to a shrinking portion of the market. Medicare Advantage, BCBS, Aetna, Cigna, and UHC each present distinct billing challenges that multiply the operational burden. Here's what many agencies discover too late. Agencies that attempt in-house Medicare Advantage billing without proper preparation often find that 20% or more of initial claims become permanently unrecoverable, revenue lost not to poor care, but to billing complexity that exceeded internal capabilities. And if federal complexity wasn't enough, state-specific requirements create additional compliance burdens. Electronic visit verification requirements under the 21st Century Cures Act mandate electronic documentation of service delivery for Medicaid-funded home health services. Each state implements these requirements differently, requiring agencies to navigate varying portals, data submission formats, and compliance deadlines. Unlike physician offices, where billing follows relatively standardized encounter documentation, home health reimbursement hinges on OASIS assessments, timely notice of admission filings, and physician orders that may take weeks to obtain. When documentation is incomplete or late, claims can't even be submitted. Revenue sits stuck, invisible in standard reports, while cash flow suffers. So what makes effective home health billing outsourcing different from the alternatives that don't work? First, when claims get denied, the billing company's response determines whether you eventually collect that revenue or write it off permanently. Effective home health billing outsourcing means every denial gets worked, not just the easy ones. This requires adequate staffing, which is precisely what low-cost billing companies sacrifice. Second, the billing process doesn't start with claim submission. It starts with patient eligibility verification. Home health operates on a model where agencies provide multiple visits over extended episodes of care. If eligibility was invalid from the start, your agency faces zero reimbursement for all services provided during that episode. Third, specialized home health billing companies provide analytical capabilities most agencies lack internally. Your EHR system likely generates dozens of reports, but can it tell you exactly where revenue is stuck right now? Can it identify which clinicians consistently have documentation problems that delay billing? Can it spot payer-specific patterns that predict future denials? Here's the hidden value most agencies don't consider. A single agency sees only their own billing patterns. A specialized home health billing company sees patterns across many agencies, quickly identifying what works and what doesn't. You're not just paying for claim submission, you're accessing expertise built across years of specialized focus on home health billing. When evaluating your current performance or potential billing companies, focus on metrics that directly impact your cash flow and revenue. How much revenue are you collecting? What % of your patients are getting paid, especially the tough ones like Medicare Advantage? How much billed revenue gets permanently written off? Some billing companies promise great results using metrics that sound impressive, but don't actually matter, or worse, can be easily manipulated. Any billing company promising specific results for your agency before seeing your data is making promises they cannot keep. Several signals indicate your agency has reached the point where home health billing outsourcing becomes the right strategic decision. Census and revenue don't align. You're seeing more patients, but cash flow hasn't improved proportionally. Cash flow is unpredictable, making planning impossible. Growth has stalled because billing constraints hold you back, or costs are rising without results. You've invested in staff, software, or training, but collection rates haven't improved. Here's the reality. Every month of inadequate billing represents revenue that may never be recovered. Many claims cannot be fixed after the fact. cash flow that should support growth instead, forces difficult decisions about staffing or expansion. Home health billing outsourcing isn't about admitting defeat, it's about recognizing that a knowledgeable home health billing company with real experience and data delivers results no in-house biller can match. The agencies that thrive in today's complex regulatory environment aren't necessarily the largest or most aggressive in pursuing referrals. They're the agencies with reliable cash flow, minimal write-offs, and the financial visibility to make strategic decisions with confidence. If your agency is experiencing unpredictable cash flow, aging accounts receivable, or growth constraints due to billing complexity, contact us today for a free consultation. We'll help you analyze exactly where your revenue is stuck and show you how specialized home health billing outsourcing can transform your cash flow and free you to focus on what you do best, delivering excellent patient care. Don't forget to subscribe for more insights on optimizing your home health operations, and check out our next video where we dive deep into the specific metrics that actually predict billing success versus the vanity metrics that billing companies use to hide poor performance.